Vitamin B12, also called cobalamin, is an essential water-soluble nutrient with a key role in the normal functioning of the brain, nervous system, and for the formation of blood. Vitamin B12 works closely with B9, also called folate or folic acid, to help make red blood cells and to help iron work better in the body. Folate and B12 work together to produce SAM, a compound involved in immune function and mood. A deficiency in vitamin B12 is a serious nutritional concern, which can result in anemia and a change in nervous system function. Some symptoms include numbness and tingling in the arms and legs, weakness and excessive fatigue, and a range of psychiatric disorders including disorientation, depression, irritability, and dementia. Long-term consequences of vitamin B12 deficiency in infants include developmental delay both physically and mentally, which may last into adulthood. In the elderly, neuropsychiatric disorders caused from a vitamin B12 deficiency are often irreversible. We only need about 2.5 micrograms of vitamin B12 per day. 1 cup of whole milk has about 1 microgram, while a serving of B12 fortified cereal has about 1.5 micrograms. Because vitamin B12 is produced in nature only by vitamin B12 producing microorganisms, humans must receive vitamin B12 solely from the diet. Dietary sources of vitamin B12 come primarily from animal products, which get their cobalamins from microorganisms and vitamin B12 fortified foods. Beef, liver, and clams are the best sources of vitamin B12, as well as fish, meat, poultry, eggs, milk, and other dairy products. Some breakfast cereals, nutritional yeasts, and other foods products also contain vitamin B12. Vegetarians who do not eat any meat and sometimes do not eat eggs are often said to be at risk for a vitamin B12 deficiency. Whereas vegetarianism is present in all geographic areas, only in the past 50 years was it recognized that vegetarians have a consistently lower vitamin B12 deficiency than non-vegetarians. Higher rates of deficiency were reported among vegans compared with vegetarians and among individuals who had adhered to a vegetarian diet since birth compared with those who had adopted such a diet later in life. But there are vitamin B12 supplements available, so the question is if meat is necessary in order to get enough vitamin B12, or if vegetarians are not able to get enough vitamin B12 without animal sources. That's it.
B12 is an essential nutrient that is required for many functions in the human body. For example, B12 is required for the conversion of homocysteine to methionine. Without B12, we will have a buildup of homocysteine in the body, which is directly related to an increased risk for cardiovascular disease. B12 is also essential for other functions in the brain and nervous system, as well as folate metabolism. Without proper B12 levels, issues may occur that will damage and affect DNA synthesis, fatty acid metabolism, amino acid metabolism, and many more. B12 is only synthesized by microorganisms. This means that all animal sources contain the highest bioavailability of B12. Shellfish contain the highest amount of B12, having 84 UGs per 3 ounces. B12 is only synthesized by microorganisms. This means that all animal sources contain the highest bioavailability of B12. Shellfish contain the highest amount of B12, having 84 micrograms per 3 ounces. Other high sources of B12 are liver, fish, and red meat, which range from 70 micrograms to 20. The only way B12 could be found in plant forms is through contamination within the soil. This is the reason why B12 is considered such an issue for vegetarians. It has been found that B12 deficiency is extremely common in this population, as will be discussed later on in this debate. Although B12 is found in dairy products like milk, eggs, and cheese, the availability of B12 is much lower. This means that even if vegetarians eat dairy products, they will need to consume large amounts of these products to reach the recommendations. Signs and symptoms of B12 deficiency range from change in skin, fatigue, having shortness of breath, insomnia, and neurological problems. If found B12 deficient, one could have permanent mental conditions and nerve damage. Getting vegetarians to consume more B12 through various forms will be challenging, but it is needed for their health. After you've heard the numerous studies and facts comprised about B12 deficiency, the concern for vegetarians will be clear. Throughout history, there have been many instances where patients come in proclaiming that they are vegetarians or vegans, but they are fatigued, suffer from daytime sleepiness, risk of heart disease, megaloblastic anemia, and nervous system complications.
One study conducted in Britain investigated serum concentrations of B12 in British males. This was a study that compared omnivores, vegetarians, and vegans. This study not only investigated the concentrations of B12 in omnivores, vegetarians, and vegans, but also looked at a possible relationship with age. This was a cross-sectional analysis that investigated 689 men, 226 who were omnivores, 231 who were vegetarians, and 232 who were vegans. The results of this study showed that omnivores had the highest concentration of serum B12 levels at 270 to 292 picomoles per liter. Medium levels were found with vegetarians at 175 to 189 picomoles per liter, and the lowest levels were found with vegans at 117 to 127 picomoles per liters. When looking at a percent of each group that was deficient, 52% of all vegans were deficient, 7% of all vegetarians were deficient, and only one omnivore was classified as deficient. There was no association with age in any of these groups' serum B12 levels. This study also investigated folate concentrations in each population studied. It was determined that folate concentrations were highest among vegans, followed by vegetarians, and omnivores had the lowest folate levels. 2 men were found to be folate deficient, having serum folate levels less than 6.3 nanomoles per liter, and they were both omnivores. In conclusion, this study came to show evidence that vegans have lower B12 concentrations but higher folate concentrations when compared to both vegetarians and omnivores. Half of all the vegans in this study were B12 deficient and at risk for developing symptoms that relate to B12 deficiency. There are many other specific populations that suffer from B12 deficiency. A study of 27 pregnant women who were vegetarian or vegan was conducted in Germany in 2010. In the first trimester, 33% of the women were found to be B12 deficient. In the second trimester, 17% were deficient, and in the third, 39% were deficient. This deficiency could be explained by the expanded blood volume of pregnant women. However, in the third trimester, this does not explain the deficiency because blood volume peaks and plateaus in the 34th through the 36th week of gestation. If a vegetarian woman are deficient in B12, their infant will be deficient as well and result in the infant's ability to thrive, inability to accept food, and stunting and developmental delays. This can all be prevented by simply taking a B12 supplement, especially for vegan and vegetarian pregnant women. One study even found that among participants who were consuming vitamin B12 fortified foods, there was still a decline in serum B12 levels over the 5-year period of the study. This goes to show that B12 fortified foods don't provide the amount needed, and many do not prevent long-term deficiency. A higher dose of B12 needs to be ingested. This is especially true for older adults and the elderly who have age-related declines in absorption rates.
Woo!
As Allie said, someone suffering from vitamin B12 deficiency could experience skin trouble, fatigue, shortness of breath, insomnia, and neurological problems. But much more could also be at risk due to the role that B12 plays in the conversion of homocysteine to methionine. Vitamin B12 takes a methyl group from 5-methyl tetrahydrofolate to form methylcobalamin and attaches to methionine synthase to activate the enzyme, which then synthesizes methionine. When someone is deficient in vitamin B12, it becomes very difficult for the process of converting homocysteine to methionine to occur. Therefore, homocysteine levels tend to rise in the blood. Increased homocysteine in the body can lead to hyperhomocystinemia. This is defined as an abnormally high level of homocysteine in the blood, specifically about 15 micromoles per liter or more. Due to the lack of vitamin B12 in their diets, vegetarians and vegans have an especially high risk of developing this condition. One study conducted by Ibrahim Al-Madfa and Ingrid Singer, published in the American Journal of Clinical Nutrition, found that 66% of vegans and 52% of vegetarians had serum homocysteine levels that were above the normal range. This study also showed that hyperhomocystinemia was responsible for about 10% of cases of cardiovascular disease. Even mild cases of elevated levels have been shown to pose an increased risk. Elevation of homocysteine has also been associated with several other conditions such as osteoporosis, cognitive impairment, prenatal complications, and kidney disease. Due to their high bioavailability, it is necessary to include animal foods in the diet in order to maintain adequate B12 and homocysteine levels. A diet without animal foods is bound to be lacking proper amounts of this vitamin, which would lead to high levels of homocysteine. And now we will be hearing from the opposing side, who will discuss reasons why they believe B12 deficiency is not necessarily an area of concern for vegetarians and/or vegans.
The problem with B12 deficiency for vegetarians is that there is usually only found in animal-derived foods. Although this includes foods that aren't animal meats like eggs and milk products, the content and bioavailability of B12 in these products are very low. As Ali mentioned earlier, vitamin B12 deficiency can cause serious health problems. Although vegetarians are at higher risk for developing these deficiencies, there are fortified and plant-derived food sources that will prevent these deficiencies. Many breakfast cereals in the U.S. are fortified with B12. The U.S. Institute of Medicine committees found that these cereals provide a significant amount of B12 for both vegetarians and non-vegetarians and will prevent deficiency. Although B12 is found very low in soybeans, the fermented soybean-based food tempeh contains between 0.7 to 8 micrograms per 100 grams. This increase in the amount of B12 is likely due to bacterial contamination during production. Vegetables can also be fermented with certain lactic acids and propionic bacteria, which can provide about 10 micrograms per 100 grams of vitamin B12, which will provide the RDA for vitamin B12 of 2.4 micrograms per day for adults. There are also many forms of edible mushrooms that contain significant amounts of B12, which are popular among vegetarians in many European countries. Black trumpet and golden chanterelle mushrooms contain significant levels of vitamin B12, which is between 1 to 2.6 micrograms per 100 grams in dry weight. Dried shiitake mushrooms also contain on average 5.6 micrograms of B12 per 100 grams in the inactive form of vitamin B12, which is C-lactone. Although this seems like this would provide a significant amount of B12, Stabler found in a study on rats that this inactive form of B12 binds very weakly to vitamin B12 binding proteins and inhibits vitamin B12 dependent enzymes. Edible algae, especially purple laver, contains substantial amounts of vitamin B12, approximately 32.3 micrograms per 100 grams of dry weight. It is one of the most commonly consumed forms of algae in Korea. However, to gain the optimal amounts of vitamin B12 depends on the cooking process. If the algae is toasted and seasoned, the amount of B12 significantly decreases, but if the algae is dried, it will provide a substantial amount to where a vegetarian could consume about 4 grams of dried purple larvae per day to supply the RDA of 2.4 micrograms per day. In conclusion, vegetarians can avoid vitamin B12 deficiency if consuming these specific fortified and plant-based foods, especially purple larvae algae. Researchers today are also attempting different ways to avoid deficiency in vegetarians that don't eat these specific foods by creating vegetables that are enriched in vitamin B12. Their current enriching techniques, though is beneficial to vegetarians, is an artificial solution treated on vegetables containing animal products, so it's not acceptable to their beliefs.
A recent study published in the Journal of Medicinal Food found a plant-derived bioactive form of vitamin B12, which is commercially available in supplements containing chlorella pyrenodosa. Each tablet is 60% protein, 20% carbohydrate, 11% unsaturated fats, and 3% chlorophyll, and contains vitamin C, beta-carotene, thiamine, riboflavin, pyroxidine, niacin, pantothenic acid, folic acid, B12, biotin, choline, vitamin K, lipoic acid, lutein, inositol, and minerals phosphorus, calcium, zinc, iodine, magnesium, iron, and copper. Previous laboratory tests show that chlorella pyrenodosa is a biologically active form of vitamin B12. So this specific study was conducted to prove that it was also physiologically active in humans. Total serum cobalamin is neither sensitive nor specific for vitamin deficiency, hence why this study assesses various serum metabolite concentrations like methylmalonic acid, which are more sensitive tests of deficiency. 17 vegan and vegetarian adults with a known B12 deficiency, as evidenced by a serum methylmalonic acid level of 270 millimoles per liter, received the chlorella supplement daily for 60 days. Blood was collected on 3 visits throughout supplementation to evaluate a complete blood count, mean corpuscular volume, hemoglobin, hematocrit, methylmalonic acid, homocysteine, and serum B12. After 30 and 60 days of supplementation, serum methylmalonic acid fell by an average of 34%. Homocysteine trended downward and serum B12 trended upward, averaging a 27% increase. The results of this work suggest that the vitamin B12 in chlorella is bioavailable, and dietary supplementation with 9 grams per day is a natural way for vegans and vegetarians to get the vitamin B12 that they need.
As dietitians, it is important to realize that some deficiencies are not due to a person lacking in certain dietary components or from not taking a supplement. I would like to argue that it is not always vegetarians or vegans that suffer from vitamin B12 deficiencies. For example, one could have pernicious anemia, which could cause a vitamin B12 deficiency. Pernicious anemia is a shortage in properly functioning red blood cells caused by an autoimmune disorder that leads to cobalamin deficiency. That being said, pernicious anemia is defined by vitamin B12 deficiency, which stems from a lack of intrinsic factor as a result of autoimmune degradation of gastric body mucosa and loss of gastric parietal cells. The parietal cells are responsible for secreting hydrochloric acid and intrinsic factor into the stomach. The parietal cell antibodies that are found in patients with pernicious anemia target the proton pump, which raises the pH of the stomach. With a disturbance in this proton pump, hydrochloric acid will not be present in adequate amounts, which means that the protein attached to the dietary cobalamin will not be released. With cobalamin still being bound to this protein, it will not be absorbed. The intrinsic factor antibodies disturb cobalamin absorption by interfering with the intrinsic factor vitamin B12 binding receptor in the ileum of the small intestine. With intrinsic factor cobalamin receptor being blocked, B12 can't be absorbed and it will likely be excreted. Pernicious anemia cannot be treated with an oral B12 supplement, and instead B12 needs to be administered via an injection of 1 milligram every day for a week, then 1 milligram every week for 4 weeks, and finally 1 milligram every month after. Pernicious anemia will require lifelong treatment, but the symptoms of B12 deficiency can be improved. However, the gastric atrophy cannot be improved with cobalamin treatment, and the patient will need steroids in order to regenerate parietal cells and renew intrinsic factor secretion. The diagnosis of pernicious anemia is dependent on atrophic body gastritis, blood examination showing megaloblastic anemia, antibodies to intrinsic factor in gastric parietal cells, and obviously B12 deficiency. Diagnosing the disease clearly relies on a number of complicated variables which suggests that the actual prevalence of the disease is underestimated. It is crucial that dietitians do not only associate vitamin B12 deficiency with vegetarians and vegans, and that they may need to investigate a low serum B12 value for an underlying inborn error.
In conclusion, vitamin B12 is an essential water-soluble nutrient with a key role in the normal functioning of the brain, nervous system, and the formation of blood. In recent years, there has been much research regarding risk for deficiency in vegetarians and those who do not consume animal foods. Those who believe animal foods are essential for proper B12 levels argue that vegetarians will have a buildup of homocysteine in the body, which is directly related to an increased risk for cardiovascular disease. In addition, they argue that B12 is only synthesized by microorganisms, which means that all animal sources contain the highest bioavailability of B12. There have been numerous studies that have found those who do not consume animal foods have a higher serum level of homocysteine in the blood. On the other hand, those who argue vegetarians can reach adequate B12 levels without animal food consumption argue that supplementation is a valid option to use to avoid deficiency. The issue arises when proper care is not taken to ensure that B12's levels are being met. In addition, as dietitians, it's important to realize that some deficiencies are not caused solely by a lack of dietary component. For example, one could have pernicious anemia, an autoimmune disease that affects the body's ability to produce intrinsic factor, which would cause a deficiency in B12. This deficiency requires injections of cobalamin and steroids to improve B12 absorption and gastric function. Yes, vegetarians are at a higher risk for B12 deficiency because the bioavailability of B12 is lower in non-animal foods. But if someone were to implement a vegetarian diet and consider the proper fortified food choices and supplementation, he or she may still reach adequate B12 levels as long as this person is not suffering from an autoimmune disease that would affect B12 absorption. What we've learned from this project is that there's still a lot of research that needs to be done regarding B12 consumption and deficiency. Since B12 deficiency can take years to fully manifest, there is still a lot of potential for future implications.